most people believe that, okay, this is morally unnecessary, perhaps, because they feel that the president has so many. I mean, he's paid $500,000 per month, if that is correct. That's what we had. So he should be able to pay for his mother's medical checkup, and instead of asking the state to do that.
And he has been doing exactly that.
He's been doing that.
He has been doing that.
But this is the very first time that such a request comes.
No, I'm saying the request is not on account of treatment of the old woman.
No, check medical catch-up or treatment is all the same.
Yeah,
I'm saying nothing is spent on her, but at least
nothing is spent on her. It's the staff. The staff are government staff. They are my office staff.
So is this first time that you requested such, or each other time they've been paid from government?
Yes, they will be paid from government.
Okay, all right. Now, most people also are concerned, since your government says, you always boast of quality medical service in this country. You sometimes say, in fact, people come here for medical tourism. So is it not ironical that when you are trumpeting quality medical service, you officials, including your family, are going elsewhere looking for medical treatment? What happened to the others who cannot afford it, who are not president's mom, who cannot have even transport fares to go to maybe to Banjul, to Neban Clinic? What happened to those people? And you keep saying that medical service quality is top notch in the government. Is that not ironical?
Nothing is ironical, Lamin. I'm saying first, the overseas treatment is not limited to senior government officials and their families. It's a centralized vote at the level of the Ministry of Health, and when cases are determined that they require overseas treatment, recommendations are made by the medical board, and the Ministry of Health will extend support. It's been done for senior government officials as it's been done also for ordinary persons. So there is no special treatment as such or as claimed. Number two, we have to understand that that is just the nature of government and development. We are better off in so many aspects. There are others who are also better than us in some aspect. In Senegal, we have seen troops of individuals, ladies and young women, coming to our health centers and primary health care and have been provided services. That is open secret. It's known. Either by proximity or service quality, they are coming. Now, in terms of higher medical service provision, we have to recognize that Senegal is much more advanced than us today. And there are cases that we cannot handle here, we will take to Senegal. There are instances cases that we can handle, we cannot handle here, we will take to India. We will take to Europe or America or anywhere that we think if we can go there and provide medical help for our people, we will do it. This is not to say that our medical services is poor or is bad. And I have made the argument that we have been comparing ourselves with our past administration performances. And we all know this administration have done far better than any administration in the past history. Yes, we recognize that Jawara time he did Bansan. We do recognize that Jame time he did Farafenye and he did Biam. But look at also what this administration did. In literally all the major district and major regional centers in this country, we have now opened major health centers, state of the art, fully equipped.
No, but the criticism have always been people go there and they don't get the right, they don't require. They have been asked to go to pharmacists.
I would respond to that. I'm talking about now in terms of investment. In the space of
but investment doesn't stop at infrastructure.
Medical health.
There should be medicine.
But let's recognize that first. I'm coming.
Okay.
Medicine or medical care is a package. You cannot do this without basic infrastructure. You have to handle one at a time. We have delivered infrastructure in the land and breadth of this country. We have refurbished significantly Edward Francis Small Teaching Hospital today. We have reopened Demban. We are building state of the art laboratory, national laboratory, that will take care of food and medicine. We are building a multi-million-dollar Farato Health hospital that will not only handle cases in Gambia but even overseas when it's completed.
So maybe nobody will need to go to Dakar.
Okay, you have to understand this, Lamin. I am saying no matter how good you are,
you will still have
need, because you cannot get everything. There are special cases that need to be referred overseas because they are specialists in their nature and they are that complex in their nature. And we can be good in one but may not be good in the other. That is just the nature of relations of our countries. And this is why we are going to Senegal. So going to Senegal is not a test for the state of the health care system in the Gambia, but rather the health outcome.
It may be
that matters here.
For example, this particular case, the old woman was supposed to go for a checkup, not just treatment, but a checkup.
No.
So you want to say we don't have the right facilities to do that kind of test here?
If you were handled overseas and you were treated there, you are required to go from time to time for medical checkup and treatment. Because
but the problem we have is that, Mr. C, we have basic things lacking, like CT scans. Those are basic things. And we don't have to go elsewhere for those things.
No, I mean, you are saying basic things,
yes.
But there are so many basic things we also have. So many basic things that we have. Even those who are complaining about medicine, I'm not saying medicine is now available throughout,
yes.
But you have to understand what provides medicine is also a chain. To provide medicine, you have to go through our rigorous administrative procurement restrictions and deliver drugs. You have to go through the regulatory test and control for you to be able to get those medicine. You also have to have the financial means to buy those drugs. So it's never going to be adequate, and it's not only inadequate, but it's also takes some time to deliver them. But let's recognize that the medical system is a system and it's a building block. We are getting there, but it will take some time. But honestly, we have to recognize, one thing we must recognize, despite all the noise, that we are better off today than we were 10 years ago, and we were certainly 30 or 40 years ago.